This is part 7 of What You Should Know About Gum Disease, the book on video. Knowledge is potential power, and I believe we should all strive to empower others as best we can. This is my little contribution towards that end. I invite you to join me by spreading the word about information on gum disease. Let us make sure everyone at least has the opportunity to understand what gum disease is and how it can be prevented or defeated. From this book, the everyday person can gain an understanding of what can happen and what to look out for. They can also get a feel for what questions to ask and when it is appropriate to seek a second or even third opinion. Each person should also become more active in his or her own situation and understand better what patients' rights are. There are borderline unethical practitioners in every profession. Unfortunately, I have had some questionable experiences with practitioners in the dental health field. If you are a dental health care professional, I am quite certain you have witnessed or experienced something sometime that seemed questionable to you as well. The best course of action for both patients and doctors is to not hide these things or even downplay them. It is important for these stories and informative examples to be out in the open. Though you could disagree with me, my opinion is that patients should not go to a dental practitioner completely ignorant and be blindly obedient to anything the practitioner does or says. Instead, I believe patients should take an active role in their care. They should learn what questions to ask and what kind of answers they should expect. In this way, average people can begin to learn about superior home care. They can begin to understand the whole process of gum disease and become active in restoring and maintaining the health of their gums so that their teeth can serve them for a lifetime. Also, they can be spared from the contribution of gum disease that gum disease makes to other diseases such as heart attack and stroke, as well as preterm and low birth weight babies. I have additional experiences with several dental practitioners that reflect poorly both on their character and their ethics. Again, please understand that this is not about the profession, only my experiences with a few practitioners over the years. Drilling a reversible pulpitis does not count as preventive dentistry, as one dentist tried to tell me. I am not the only one with a few horror stories to share. I have talked to many people over the years and have heard some of their negative experiences as well. On more than one occasion, I have been told stories of how one doctor told a patient she had X amount of cavities, like 6. When she went to another dentist, no cavities were found. Some professionals are tempted to take liberties they should not take. Many patients are too ignorant about matters relating to oral health to know when their interests are not being best served. Some doctors could label these as gray areas. I do not often see them this way. Stories like the ones above bother me at a deep level. I suspect that any dental professional who reads this, if they honestly reflect on their own experiences and knowledge of the field, will have to acknowledge there are some problems that they have also noticed among dental professionals. This applies as well to a lack of serious effort on a national or even global scale to educate the layperson about gum disease and how to prevent it, much less how to fight an existing case. This ends part 7 of What You Should Know About Gum Disease. Look for part 8 and the previous parts. This book is available in its entirety in book form at whatyoushouldknowaboutgumdisease.com. Tools that I personally think are worthwhile can be found at toothygrinsstore.com. This is Dave Snape. Thanks for listening. Shen Yun is a high-quality show coming to a city near you. I highly recommend it. Look for it, see it, enjoy it. Shen Yun.